points on the body. So your head, your arms, your legs, your scalp, everywhere. These are the switches of your control panel, okay? And what I do as a trained acupuncturist is I work on switching some of these points on and some of these points off. I'm essentially creating a combination of points in your body that are sending a program for your body to self-adjust itself, okay? So we're all about working with what you got and readjusting it so that we create balance for whatever condition you're coming in for, okay? I mean, the World Health Organization now is recognizing about, it's 31 conditions these days that they'll recognize. Very exciting. But a lot of what they're recognizing themselves is pain. So headaches, low back pain, upper back pain, wrist pain, knee pain. I get all of it. Arthritises, autoimmune arthritises. And then outside of that, I'm doing digestion all the time, stress, insomnias. I deal a ton in fertility. I do prenatal, postnatal, you name it, I pretty much do it. So,
go girl.
Yeah, just working with it. So, I get a lot of people who have kind of been through the system of medicine on the Western end of things, and they're either sort of responding or they're not responding at all, and they're coming a new pathway. And maybe direct them also towards other medicines like the chiropractor or massage therapist, you know? Sometimes dual medicines working together is what people need to get to that last little inch of being well again. So, let's see. Let me bring out my skills. Used multiple times. No. Single-use needles. They're encased in a package. After insert, they go into a sharps container and they're off to the company to deal with their disposal when we're done with them. So. Only one time. They're stainless steel. There are, like, if you want to get pricey, like there's silver needles and gold needles, but stainless steel is typically what we're using.
My daughter couldn't make it here tonight, but she'd have a couple questions. One would be that she can't tolerate any kind of a needle entering her body. So what do you do about a case like that?
It's like the needle itself? It's not necessarily like a pain?
I guess she can imagine it's a pain, but I know myself it's not a painful thing, but just the idea of the needle,
Yeah.
you know, is an anathema to her.
Sure.
So,
There's definitely different needle phobias out there. So in that case, it's really good to tell your acupuncturist when you're coming in, like, hey, nervous. Like, I can usually tell the palms go sweaty, there's signs. But there's a few things that I do because it is so strongly ingrained in people that what we're doing is similar to getting a shot or getting, you know, your blood drawn. We're not going like super intramuscular like that, so there's not a lot of pain associated with it. I see the needle before we do this. Most of the time they don't, but every so often there is a person who like feels better by seeing what's going to be happening. The other thing is I ask them, do you want me to cover your eyes while we do this? I do research at UIC for acupuncture, and a lot of those people are just kind of thrown at us from their doctor. It's like just something that they're like, okay, I'll go, but they're not prepared. And so there's a lot of fear in those situations. So covering the eyes and not telling them that I'm about to put a needle in is usually what works best for them. Because the thing is you can't really feel the needle. So if I'm not telling them that's going in, they don't even know they're getting acupuncture. One of my studies is actually it's a double-blind study, so it's people who have never had acupuncture before, and the needles are encased, so I don't know if they're going in. And the pain is so minimal that the people don't even know they're getting acupuncture when they really are. That's another thing.
Take your pressure. So I heard this as a remedy for this problem.
Yeah.
But is it as effective?
The everything but needles treatment. Yeah.
Yeah.
Yeah, so we do other things. We do cupping. We do fire cupping. So I don't know if we remember, what is it? Michael Phelps was the big cupping guy with the new therapy in the Olympics a few years ago. So it's just a glass cup. You pull the oxygen out with a flame and you put the cup onto the skin so that it pulls up. So if like somebody's coming in for pain and they're just like totally against the needles, like, yeah, we can do some cupping, but to your point, it's not as effective, but it's still, I mean, if it makes them happy and they feel better, it's still accomplishing.
Is that called acupressure?
A take-home homework I'll give a patient, like, you've got a headache, you know, stick your finger between your thumb and your big finger and stick your nail in for 30 seconds on each side. So that's more of an acupressure. There's also laser acupuncture, so it's a cold laser. That one's a lot more new. There's not a lot of research behind that because specifically on like, they say you can't do it on children, you can't do it on women of reproductive age, so it's very limiting. But yes, there are other options for sure. For pain, and I do a ton on IVF patients as well. So what you do is when you put the needles in, you just clip on to the ends of needles. I usually do like 2, maybe 4 of them, but you clip onto the end of the needle. They don't feel anything, and then I am turning up the frequency so that the patient starts to feel like a tapping sensation in the body, and that's just like, it's an extra oomph into the body for those specific points. So if I have a woman who's going through IVF and she's trying to build up as many eggs as she can in her follicles of her ovaries, then that's essentially putting that stim on your lower abdomen is essentially yelling at your brain like, hey, pay attention here most, okay? So I just tell everybody it's extra credit for your acupuncture in those situations. So yeah, ending to the insertion of needles into specific points. So there's that end of things. Is modern medicine is starting to show that there are physical changes in these people. In addition, I mean, I have a fertility practice with a group in downtown Chicago, and we don't remarket, but we don't really have to market that much because the doctors see so much progress in their patients that they just free flow them like, this is part of your treatment plan, head on over, sort of thing. So there's that spectrum of things as doctors are starting to come around and refer their patients to us. The other exciting thing that has happened this past year is insurance companies are starting to have acupuncture coverage. So we have Cigna, Blue Cross Blue Shield, correct? Mm-hmm. So yeah, like insurance
PPO.
companies are starting to cover acupuncture on policies.